Hello, welcome to another episode of In Good Health with McLaren Macomb. I'm Toya Hankins, your host, and today we're going to be talking with Dr. Gregory Gaborek about vein disease and treatment. And we'll take a trip out to MISD and catch up with high school students as they learn about diversity. But first, we're here to talk with Dr. Melissa Ianitelli about heart disease, symptoms, and treatment. Hi, Melissa. How are you?
I'm good. How are you?
Very good. Welcome.
Thank you. Thank you for having me.
Tell us a little bit about what you do as a cardiologist.
Okay, so I am an invasive non-interventional cardiologist at McLaren Macomb and McLaren Oakland. I do both outpatient and inpatient cardiology. See a lot of people with chest pain, shortness of breath, fatigue, palpitations. Treat all aspects of heart disease.
Okay. And when we talk about heart disease, is it everything to do with the heart? Is it blood pressure and heart? Because I know my grandmother, for instance, she has a medication for her heart and she has a medication for her blood pressure. Does it all go together under cardiology?
Yeah, it does. Not everyone needs a cardiologist for certain things, but we do treat things like blood pressure, heart rates. We also get a little bit more involved sometimes if you've had a heart attack or a blocked artery, or if you've had an arrhythmia or congestive heart failure. We also focus on other risk factors like diabetes, cholesterol, smoking, weight management, all of those things.
Okay.
So it's a pretty comprehensive field. We do rely a lot on the primary care physicians, to screen people and refer to us, and we work a lot times hand in hand with them on things like blood pressure and diabetes and things.
Okay, so in cardiology, is the goal a healthy heart?
Yeah, so we obviously love for people to have healthy hearts, and we see a lot of people both before they're diagnosed with heart disease and after they're diagnosed with heart disease.
Okay.
So some people come in because they have a strong family history and want to know,
Be proactive?
is there something I can do to lower my risk? But then we also see people that have, already had their heart attack or something like that. And we do a lot of screening, based on certain symptoms for various kinds of heart disease. We get nervous when you feel bad. So if your blood pressure's low, that's okay if you feel good. If you're lightheaded or dizzy, you're really tired, can't get up and go, short of breath, things like that, then we get a little nervous that it might be too low. Some people naturally have lower blood pressure, and some people may have been on medication and then lost some weight, maybe need less medications, so we just have to adjust it based on how you feel.
When you hear words like congestive heart failure, is that something, is it as drastic as it sounds, or is it treatable, or what is that?
So congestive heart failure, classically we think of it as fluid building up in the lungs because the heart can't pump efficiently to get that, fluid out. And people get short of breath, they get swelling in their legs, gain some weight, mostly can't breathe. So congestive heart failure has a number of different causes. The number one cause, is probably blocked arteries and high blood pressure. But there's a lot of treatment options out there. We can treat the cause, we can treat the symptoms. It is a serious problem, but it is very treatable. Requires, compliance and follow-up and, active effort on the patient's, perspective as well as the physician. But there's definitely treatment options out there, and cardiology is one of those fields that's great in that it's always advancing, and there's always, we're always looking for something else, to help, whether it's medicine or a device or, some kind of intervention that can, help prolong people's lives. But many people live a long time with congestive heart failure.
Yeah, I think that, I've had conversations with people where they say, my mom has congestive heart failure. I don't know how much longer she has or that sort of thing. But really, it's something that's treatable and manageable. So it sounds worse, I think, it sounds so scary when you think about it. But that's good to know that it is treatable.
It is. And some
manageable.
People have a worse case than others. And, your survival is less than if you didn't have congestive heart failure, but there's definitely treatment options out there.
Okay. statistics show that women are at the greatest risk for heart disease and die from heart attacks and things of that nature. Why is that?
So the number one killer in both men and women is heart disease.
Okay, so it's not limited to women, it's men too.
Yeah, and a lot of times we think, heart disease meaning coronary artery disease or blocked arteries causing heart attacks affect men, and they do, but they also affect women. And it's the number one killer. It kills more people than breast cancer.
Wow.
And other cancers. And it's something that, we like to bring awareness to, because sometimes women have different symptoms than men do, and sometimes they present later or, think it's something else. When really it's a critical problem, and we just need to focus on educating and getting that out there so people know what to look for.
Okay, so it's the number one killer in both men and women. So what are some of the risk factors? Like, what makes this so incredibly such a big factor for everyone?
So common risk factors: high blood pressure, high cholesterol, diabetes, obesity. Other things you can't change is your age. As you get older, your risk goes up. Your genetics, so your family history matters a lot.
Okay.
So there's a lot of different risk factors, that some you can change and some you can't. Smoking is another one. So, society inherently has, a bigger risk as you get older because we're living longer. But the things that you can do, is, stay active, watch your weight, quit smoking, and then control your blood pressure, blood sugars, things like that. So, there's
diet and exercise.
Exactly.
What about the environment? Are environmental factors
probably
an issue?
the biggest thing is probably the food.
Okay.
More than anything. Processed foods, fast foods, convenience things tend to have a lot of salt. Just generally not be, as healthy as, we can be. Focusing more on fresh foods is nice, to help, steer your diet in the right direction.
Yeah, that's great. And it seems like people are becoming more aware of, eating healthier and especially like it's awesome in our community. We're seeing more green spaces where they're doing more fresh food markets and that sort of thing, giving people more options.
Exactly.
To be healthy. So
yeah,
that's a
access
good
is
thing.
big, and just knowing, what are good choices.
What are some of the early signs for people to become aware that something's developing, so that they can be aware to check it out?
So the most common things that we see are things like chest pain, and a lot of people don't say that they actually have pain. They say, I have an ache or a discomfort or a heaviness or something just doesn't feel right. A lot of people don't use that word pain, like we do. Do you have chest pain? Well, no, I don't have any pain. I have this ache. And, that's something that shouldn't be ignored, especially if it's exertional. So if you're getting symptoms with walking up a flight of stairs or doing something exertional, or you're not able to do as much as you could 3 months ago or 6 months ago, that's something that's concerning. Shortness of breath, fatigue. Sometimes, the classic, symptoms are that chest heaviness right in the center of your chest, goes to my left arm, makes me nauseous, sweaty, short of breath. But not everyone gets that. Some people get jaw pain, some people get a burning, some people just feel generally unwell. Women and diabetics tend to have a little bit more atypical symptoms than men do. So, maybe it's, both arms are achy, or my jaw hurts, or I'm getting this burning sensation. I can't do what I, want to do. Those kinds of things should be checked out.
Yeah, not just chalk it up as, I'm getting older, and so I'm moving a little slower, or that sort of thing.
Yeah, we hear that a lot. I gained some weight, so that's probably it, or I smoke, and it's probably that, a lot of people tend to push it off or say, I'll try and sleep it off or see what happens. But, if something's, really not feeling right, it's always better to get it checked out.
Listen to your body.
Yeah, for sure.
Yeah, that's good. how does a person detect that they have an arrhythmia? Like, what is that? What is an arrhythmia?
So an arrhythmia is a problem with the electrical portion of the heart. So the heart basically has plumbing and electrical. The plumbing is the arteries, gets the blood supply to the heart. The electrical makes the heart beat in a normal, rhythmic fashion.
Okay.
So when the heart rhythm short circuits in some, way, you can get arrhythmias. There's upper chamber arrhythmias and lower chamber arrhythmias. Lower chamber arrhythmias tend to be more dangerous. Certain arrhythmias can make you feel lousy. They can make you feel lightheaded or dizzy, heart racing or skipping, short of breath, tired. And depending on what kind it is, there's different risks associated with arrhythmias.
And you can actually feel it.
Some people can feel it and some people don't. But if you do feel it, the palpitations, lightheaded, short of breath, dizzy, some people get chest pain and just overall tired.
You offer non-invasive services.
Yeah, so we use a lot of non-invasive testing, stress tests, ultrasounds, or echoes, to screen people for heart disease and for surveillance in people that we already know have, heart disease. So, those things are tools that we use to risk stratify people and treat people, based on, their symptoms and their specific problem.
Mm-hmm. And how can a person who has heart disease in their family be proactive?
I would say the number one thing they can do is know their risk factors and have a primary care physician. Someone that they see regularly for physicals, even if they're feeling well. Those are the people that catch things early and work on risk factors and, modifying those risk factors. We see some people in the office for screening as well, but really primary care physicians play a huge role in preventive heart disease.
Dr. Melissa Ianitelli, thank you so much for being here. We really appreciate you being our guest and giving us so much incredible information on cardiovascular health.
Oh, thank you so much for having me. It's been a pleasure.
Learn more about your risk for heart disease at mclaren.org/Macomb Heart Assess.
And now let's head out to MISD.
Hi, my name is Pam Lavers. I'm Deputy County Executive. I work with Mark Hackle, and my main role and responsibilities are community relations, outreach, and cultural affairs. And part of that cultural affairs is something I'm very passionate about, which is the One Macomb initiative to promote multiculturalism and inclusion efforts in Macomb County. Is one of my favorite things we did. This is our second year. So we bring in high school students from every high school in Macomb County, 21 of them, plus some of the middle school students. And we have a day of education about diversity and inclusion. We provide opportunities for students from the north end of Macomb County to meet our students in the south end, because there's differences in what happens up in our 20% agricultural community compared to our more compacted communities. And then we have them experience things together and learn. We teach them about multiculturalism and cultural competency, of how to do things in their community, in their schools, in their lives, with their family, with their friends, about being more culturally competent and understanding and building a more rich and vibrant community by being more multicultural. Macomb County has become much more diverse. 10, 20 years ago, we were mostly a white community, at 90+% white 20 years ago. And today, we're much more diverse, with probably 80%, 70% white, and much more diverse today. Macomb County is changing, rapidly changing, and in another 10, 20 years, we're going to even look much more diverse than we are today. And it's important for our students to embrace those changes to make our community a much more welcoming and inclusive community.
Learn more at makemacomb.com.
And now we're here with Dr. Gregory Gaborek. So Dr. Gaborek, tell us a little bit about what you do.
I'm a board-certified general and vascular surgeon. Majority of my practice is specializing in vascular diseases, arteries and veins, etc. Of course, working for McLaren Macomb. Also, program director of the general surgical residency as well. Very excited about the recent opening of our new vein center just down the road from here. Long overdue.
Tell us a little bit about veins. I know it's something
Veins.
that haunts many women, varicose veins in particular. Tell us, what is it and how can we avoid them?
Yeah, veins. Well, something that I've been interested in for many, many years. Early on, vein disease was sort of like the quote-unquote redheaded stepchild of abnormalities or disease states because in general, really before 2000, it was treated medically with large amounts of compression, wraps, etc. Those patients were lifelong patients of physicians, and the procedures that we had back in the day were quite aggressive and led to prolonged healing times, downtime for individuals, and quite significant to that patient as far as comorbidity after the surgeries. And then around 2000, early 2000s, the introduction of less invasive procedures was undertaken. And that really has evolved up into today, to where the majority of vein disease treatment strategies is around minimally invasive procedures. Typically, when I talk with patients, I think the best thing, if not all, the main thing is education. What are veins?
Now, should people be concerned about the veins when they start to protrude and become really visible through the legs? Is it a chronic situation? Or?
Yeah, just to extend that on, what are veins? And that's probably one of the very first questions I ask my patients. Just as I'm asking you, I say to them, what is a vein? I always forget. What do veins do again? Good. Because arteries and veins are commonly back and forth. Patients use them as if they're the same thing. And I always tell them, no, let's think about what we're talking about. Veins take blood back to our heart.
Okay.
And so most commonly in our legs, that's what we're talking about. If we think about it, veins are taking blood back to the heart pretty much against gravity throughout the whole day. And so for many different reasons, these veins can become abnormal in their function or diseased as we talk about it. What keeps the blood moving one direction in veins are valves, and most commonly people have valve abnormalities where their valves simply tire out, and that can occur for many reasons. It can occur just from us living. Age over 50 is one of the biggest risk factors for developing poor vein function or poor valves or leaky valves. Being a woman, women with 2 or more pregnancies have a higher risk. Prior injury, blood clots is a big thing. Prior surgeries on the legs, etc. Family history of vein disease as well. Those are really the big risk factors that I tell patients. Now, people are always coming to me with the symptoms. So if we think about veins and what they do, take blood back to the heart, and if those veins aren't working well, then that means that we are not returning the blood back to the heart from our legs. Well, where is that blood or that volume staying? It's staying in our legs. Well, what can happen then? And those are really the symptoms. If we're not returning that blood volume and that fluid back to our heart, then our legs are going to withhold that fluid. And so swelling is a very common symptom. Swelling where? Well, it can be all within your tissue or it can be within the veins themselves. Swelling in a big vein by the skin, we call that varicosities, right? Okay. And then people can have all different types of symptoms of that. Varicose veins are the largest veins. Smaller veins, they can look like a big bruise. We call those telangiectasias, or the dark purple ones. Those are called reticular veins, etc. Those are all signs and then the symptoms of leg swelling or achiness or your legs feeling heavy throughout the day. Are the most common signs and symptoms of having poor blood return or poor vein function. It can proceed.
Let me ask a question.
Oh, go ahead.
So the people who are at risk, you said women, you said women after pregnancy.
Sure.
You know, and you named a few others that are just very common and broad. Like,
Oh,
so
definitely.
what would women or women who have children or some of the other people that are at greater risk do to avoid it? Like, is there a way to, what kind of things can they do to
Tongue
keep
in
their
cheek,
veins
yeah.
healthy?
Tongue in cheek, I always tell my patients when they ask me that similar question, well, what can I do now to not have any other vein problems? I say, well, we'll stop time.
Okay.
You know, we will no longer age, because age is the biggest risk factor.
Okay.
And if you can imagine, as we get older, things start to wear down. And so most of the things you can't avoid, you
Okay.
can't do. Now, some of the risk factors that we have are prolonged immobility, you know, where we're not exercising, et cetera. And then other things like prolonged standing or sitting in this position can increase your risk as well. But the majority of time, the causes of vein disease or progression or chronic vein insufficiency, which is really like the umbrella term to all these signs and symptoms, occurs somewhat naturally throughout our life. The majority, I guess it's estimated about 30% of all adult Americans have some isolated form of vein dysfunction or disease at any time, and it progresses every decade after age 50. So most of the time, with
Does
my
working
patients,
out or anything like that help?
well, working out, just walking, really, the vein's job is to return blood back to the heart. And by walking and being active, it really reduces the pressure within the veins as long as your valves are competent or functioning well. The veins do a great job at doing that. It's whenever these valves become incompetent is when we start having increasing stagnation of blood or poor blood return. And that's where our therapy really starts, where I'm sure you've seen or know people that wear those compression stockings. That's where those are instituted. The stockings, again, don't do anything to make your veins better. What we're trying to do is alleviate the symptoms or slow down progression of vein disease. So that's number one.
And at what stage in a person's life would it be advised for them to see a vascular surgeon?
Right. What's interesting about vein disease is it goes hand in hand with how we get older. And so most of the time, I'm no different. You know, as we get older, we just can't seem to, we get tired a little bit easier, or, oh, my legs are hurting throughout the day. And we, a lot of times, shrug that off as being, oh, I'm just older. I'm not as fit as I used to be. Any sign or symptom of anything, let it that be veins or anything like that, but any sign or symptoms of leg swelling is key. Skin changes, any varicosity or blemish, or aching, tired legs that are sort of prohibiting you from doing what you want to do. That's the classic signs and symptoms of what brings patients to me. Understanding, I guess, or that education of understanding what veins do and the risk factors really then can be suited for each individual.
And you really got to listen to your body.
Oh, definitely.
You know, like you were saying, people chalk things up as, oh, I'm over 50, I'm over 40, so I'm slowing down. But listen to your body, follow through, and check
Keep
it out.
regular doctor visits with your primary care physicians. That's an excellent way to keep attuned, because with a regular and thorough physical exam that we should be getting every year, you know, your physicians, your primary care physician should be able to isolate that, or at least educate you and direct you, at least to me, if you want, should you have those or need second opinions.
Tell us about the new center that's opening.
I'm very happy, and it's almost like finally. It allows us the ability, I believe, to be more complete and comprehensive in our care. I see a lot of patients who have had multiple vein procedures in the past, and that's one of the very first questions I ask them. What does a vein do again?
Yeah.
And whether they fail to recall, et cetera. I think more often than not, I know with vein disease, now that it's becoming more minimally invasive, many more people are doing it. And that's sort of how the evolution has occurred. And I think with me, internally, I want to make sure with every patient that I see that it's individualized. Every person is not the same. Every expression of vein abnormality is not the same. And what works for one person isn't the necessary treatment strategy for all. And so it starts with that baseline assessment, discussion with the patient, the education, and then setting a goal. A goal for a young lady in her 30s may be totally, and usually is totally different than a gentleman who's 75.
Makes sense.
And so when we have goals that are discussed, then our outcomes are always going to be better. And when you know with the Vein Center that you're going to be provided with state-of-the-art care by board-certified vascular surgeons, I believe that allows us to treat patients comprehensively, all comers, whether that be the smallest of spider veins, where they're looking for more of a smaller, minimally invasive procedure, cosmetic procedure, all the way to we see a large number of patients who have had blood clots in their legs. And those blood clots, if you can imagine, are obstructions to the veins. And now they have the sequela of having that obstruction where they have skin changes or wounds that now that they're dealing with much more severe than the small little blemishes. And those patients at the Vein Center, now we can provide them with care, and those are the ones that we will be doing at the hospital.
I think that's great. I mean, you know, something that is potentially inevitable, like you mentioned, with age.
Right.
You know, and now people having a location where, you know, you can be serviced and don't have to bop around from office to office and get everything done in one place sounds fantastic.
Well, thank you.
Yeah.
No, I'm excited, and the key word I think is comprehensive, and so there is not anything that we can't do with that mix of both as an outpatient setting in a vein center, as well as the most invasive or aggressive type of vein procedures for some individuals that we see, especially those with blood clots, where we're taking them to the hospital and back and forth. I think it's a perfect handshake of the two.
Dr. Gaborek, I really appreciate the conversation. I think it
my
was
pleasure.
great. And good luck with the Vein Center.
Thank you.
And we appreciate you being here today.
I really appreciate this opportunity. Thank you. Too.
For more information, visit mclaren.org/Macomb Vein Assess.
Thanks for joining us. We'll see you next time on another episode of In Good Health with McLaren Macomb.
To watch this episode again, visit mclaren.org/Macomb blog.